We are back on MorningLine. Thanks for joining us. We're on Facebook at News Channel 5 if you want to visit us there and comment on this. We've got some comments for our guest, Dr. David Aronoff from over at Vanderbilt. Address the issue of the numbers, and I'm not just talking about local, but nationally. And there are those out there that continue to make the argument that you can't believe the numbers, that they, have been inflated. There are false positives being reported as positives, and that it skews numbers. And they just say, look, it's not as bad as everyone's saying. These numbers, I don't believe any of the numbers out there. What do you say to that?
Well, I understand there's a lot of uncertainty about that, particularly people who don't spend, their time like I do, just sort of constantly engaged in COVID-19. It can be confusing for sure. The tests that are currently available for active infection with COVID-19 are pretty accurate. Certainly false positive results are pretty uncommon. False negative results can occur, particularly very early after infection. If I get infected today, my test won't be positive today. It can take some time for my test to turn positive, for example. So we always are on guard for false negative results. And occasionally we see people who absolutely look like they're suffering from COVID-19 and their initial test was negative. And so we generally retest those patients. But the testing right now that we're using in the United States, the molecular testing, is accurate. And we're having to do a lot of testing to identify the cases that are out there, but doing all that testing is really helpful. For example, in Tennessee, a little bit under 10% of all the tests that we do are returning positive. So, we're having to do, for every 100 tests, about 8 or 9 are coming back positive. It's also important for people to know that of those positive tests, the people with COVID-19, the vast majority are not ending up in the hospital and not ending up dying from COVID-19. In fact, in Tennessee, a little under 5% of the people who have been diagnosed with COVID-19 are ending up in the hospital. So that means 95% of people with COVID-19 are not getting sick enough to be hospitalized. Unfortunately, about 1 out of every 100 people who have been diagnosed are dying of the disease. And so one of the things that we watch very closely is how many people are being hospitalized with COVID-19, because it's really hard to debate that they're not sick from the infection. And we're watching how many people are succumbing to the infection on a daily basis as well. So it is really important that we test. We can't find cases if we don't look for them. It's also very important that when people test positive that they self-isolate and protect others from getting infected. But it's still a situation where we've had over 1,000 people who live in Tennessee die of this infection. So we got to keep our guard up.
Yeah, and that 5% may sound low unless you're one of that 5% getting sick and not recovering right off the bat. Let's go next to Ron. Ron, good morning. Do you have a question for the doctor? Ron, are you there?
Yeah.
Go ahead, sir.
I got a question.
Okay.
I want to know, I noticed on the news this morning where some old girl that took a picture of them all crowded in the school halls with no mask and stuff in the schools, and they suspended her for school for taking the picture. If the governor of the state of Tennessee, if I heard him right, he said they weren't going to release the results for the schools that do have the coronavirus in them until they decided what to do about it. It's sort of like a nursing home. They kept it covered up and they're not allowing the public to see what's going to happen. If we get a pandemic in these schools, I want to ask you, how's the public going to know which school it's in to keep their children out of that school, or to know that this is becoming really dangerous before it does get dangerous?
Great question. Dr. Aronoff, he's right. He mentioned early on the situation with nursing homes and assisted living facilities. They weren't being real transparent at the outset on cases like that, and thankfully, largely because of the work of our I-team here at News Channel 5, the governor came around and they started releasing those numbers. I think the same thing should apply in terms of transparency, reporting if schools have an issue with COVID outbreaks, making sure they protect the HIPAA laws. Raw numbers without releasing names you can do. What are your thoughts on that? Don't you think that stuff should be transparent?
Well, Nick, thank you for bringing that up. And Ron, thank you very much for your question. I think this is on a lot of people's minds as parents are sending children back into schools. And I really agree that the best way that we can all move safely forward through this pandemic is through understanding. It's knowing the data, knowing where infections are, and knowing how best to protect people from spread. And something Nick brought up that I think is really, and you did as well, Ron, that's really important, is that we learned a lot early about the contagiousness of COVID-19 by seeing outbreaks in incarcerated individuals, in persons living in long-term care facilities, nursing homes, and those sorts of facilities. It really opened our eyes to just how transmissible this virus can be. And so now that people are getting back together in schools, just like in businesses, we're likely going to see more cases, and being able to handle those from a public health standpoint will depend on knowing where the cases are and whether there's sort of a local institutional epidemic happening in the context of this pandemic. So I think the more transparency we have, the more data that are shared, the better. And I really appreciate you bringing up that point.
And I suspect hopefully that will be the thing, that they will release those numbers so we can know, and parents need to be aware as they make these decisions for their kids. Just the question now with regard to employment and getting back. And we know, for instance, there are so many people struggling, and this is a hard part of it for a lot of them through COVID-19. The unemployment, the benefit that was coming from the federal government has expired, that $600 extra you got per week, putting the squeeze on a lot more people that would like to go back to work. What's it going to take for us to get back to that stage? And I hope not jumping back too quickly, because we don't want to backslide again, but to get back to work and save these businesses and save these jobs for so many people right now that are in a tough situation.
Yeah, Nick, that's an important point, is that the devastation from this pandemic has been both direct and indirect. So people get infected with the SARS-CoV-2 virus, and they may get very sick. And even if they survive a long hospitalization, they may end up with debilitation that permanently impairs their quality of life. And then, unfortunately, some people are dying of this infection. But the indirect effects of this pandemic have been devastating on our economy, and exactly what you say. In Nashville, where I live and you live, is certainly a city that thrives on the entertainment industry, the service industry, getting people back together, and has been, I think, uniquely devastated by COVID-19. And yet we've seen in some states around us that disease that was very active early, got under control, and as social distancing relaxed, we started to see a second wave in some states. Other states had never really got out of the first wave and saw an increase. And the lessons that we've learned from that are that this is a very unforgiving pandemic that is really teaching us that we need to be very data-driven and thoughtful with how and when we reactivate our economy. And I know that from my experience in Davidson County, businesses are taking this extremely seriously and are really thinking about how best they can do things. Restaurants are a good example. We've seen the way that restaurants are delivering service completely change, and now some restaurants are even having groceries available at their storefronts for pickup. Others are doing just food pickup and limited indoor dining. But finding a way to exist in a new economy until we're out from under this has been a challenge. And until we see case counts really persistently falling, it may be a bit before we get back into phase 3, but I'm encouraged by our recent numbers.
Yeah, I hope you're right about that. I'm no restaurant owner. I am someone who frequents these places now when I can safely, and I want to support them as best as I can, and I've been doing that all along. But my take is, if I am someone in this business, I'm suffering and I'm doing everything I can to try to get by, doctor. But at the same time, my big concern too, if I'm a business owner, is even as things improve, I don't want to say, hey, let's rush and reopen again and go back to phase 3. I don't want the same thing to happen again if we come back too quickly. If I'm a business owner, I want to make sure they don't come back until we're sure it's safe, so that when I can open, everyone can come back and feel safe and get back to it. Because if we kind of ease back into it slowly again, and then the public all of a sudden thinks, oh, it's fine, I'm throwing my mask away, it's just going to be a seesaw back and forth until there's a vaccine or a treatment. That's my big concern. So even as things continue to get better, as you say, I would imagine the mayor and others around, in leadership are going to say, look, this time round, yeah, maybe technically we could go to phase 3, but we're going to wait simply because we have to be sure this time we cannot afford another backslide, which will be devastating.
I like your line of thinking, yeah.
Okay, so that makes sense. All right, because I know some people are going to say, hey, we're getting back. It's looking good. Let's reopen again. No, it's just, it's like Groundhog Day. Let's learn from our mistakes. We'll take a break. When we come back, okay, the big thing on this, I think we would all agree on, what's really going to pull us through this when the time comes, beside our true grit, will be a vaccine and treatments. Because once that's in place, then we can really get working on this. That's what it comes down to. So where do we stand on all that? We'll get to that with Dr. Aronoff when we come back right after this.